Alright, as we continue through our quick tour here in the main pharmacy, one other place I wanted to make you aware of is our extemporaneous compounding section. So what we do here, most of our medications that we don't have unit dose, we prepare them here extemporaneously. A good example would be some of our suspensions, antibiotic suspensions. We have them all here in a powdered form, and then we have them all reconstituted and ensure that the stability is also okay, and then we can draw them up in syringes and send up to the appropriate patients. But most of the things that we do here are more manual extemporaneous compounding, and we do also do some unit dosing as well too for some of the medications that we don't have already unit dose. So like some meds that would be in bottles like this, we would have them all unit dose in barcoded forms like this, you know. So we end up not having to use the bottles, but we end up pre-packaging them here in unit dose formation. So, and that's really all the business that's happening here. And then we just have our storage cabinets for some documentations as well. Alright, so to wrap up this tour, I will have to show you, I can't complete this tour without showing you our IV room, our compounding room, which we call our clean room. This is where we prepare all of our IV medications. There's a lot of sterility that we put into place with all our preparations that we do here, so that's why we have our clean room, which is located all the way in the back there. Has a lot of pressures, negative pressures, making sure that all the air coming in is really clean, and this helps with preventing, you know, contamination and making sure that all the things that we are preparing on that side there are all sterile. And technicians as well as pharmacists included, once we go in there, before we go in there, we all have to be well gowned with our mask on, gown and gloves, and make sure that everything that it's all wiped down with alcohol and swab. So all the way in the back there, the products that we prepare there, we give them a longer stability because that's our most clean area of the pharmacy. On this side here where we have our technicians staying, it's also one of our clean areas, but then the stability there, we kind of narrow down our stability and give it just a less stable because the pressure that is on this side, on here, is different from what we have all the way in the back. So it's still clean, but not as clean as what we have going on the back there. So we give it more of a less reduced or less stable expiration date in the back there. But same way, same process still apply. They have to be sure that they're all gowned. We have a wash station. They know hands are clean. There's less touching of things around here, just to ensure that everything is still all maintaining sterility as we can, using all the aseptic techniques that we can use to make sure that things are well prepared, because these are stuff that we are preparing for patients and they're all going intravenously, so we have to be sure that they're all made in the best sterile atmosphere. And out here is where we have all our products and get a lot of stuff, the things that we need. There's several medications that we have here. Also, all the way in the back here, we do have our storage area here where we have most of our IV fluids, and the technicians, they grab most of the IV fluids from here, ensure that they're grabbing the right medications, they scan what they grab as well, and physically look at it and be sure it's the right fluid. And like I told you at the beginning of the tour, everything prepared here comes out to the main pharmacy. Out there, the central pharmacist physically looks at all these products and be sure that the right things is what is being mixed or prepared before it gets sent upstairs. So there's several steps and several stages of safety and care that we try to take before the meds get to the actual patients. We also have, just like we have outside our refrigerator, meds in the refrigerator, we also have some of our IV meds back here as well too. And then the techs can grab whatever they need from here to go prepare the IV room. One other thing I will show you here, we don't do a whole lot of chemotherapeutic agents here in our hospital at North Suburban, but from time to time we do get a few chemo agents preparation for some of our patients, and we don't prepare those in our clean room there. We have a special cabinet, biological safety cabinets that we use for preparing most of those chemo agents, and it has all these glove boxes and everything just to be sure that the technician or the individual making the medication is not exposed or limits exposure to those chemotherapeutic agents as well too. So, well, like I said, we don't do a whole lot of it, but once in a while we do get a few of that. All right, well, so we're back outside. I'm hoping that's just with a quick brief tour that we did, that you're able to have just a quick or brief grasp of the activity and things that we do in there in the pharmacy. There's lots more that happens there, but for the sake of time, we just kind of did a few things out there. So I do hope that that gives you a little bit of an idea of the operations of the pharmacy, and you know, if you have questions, concerns, please feel free to always call the pharmacy 303-450-4540. Every single staff in the pharmacy will be able to answer questions for you. And good luck. Thank you very much.